Canal leishmaniasis is diffused and quite prevalent in southern Mediterranean countries of Europe, where it's present the vector of Leishmania infantum, that is the sandfly. So basically, it's present from Portugal to Spain, southern France, and Italy, and all Albania, Greece, and also northern Africa. But we are observing also an increase in number of cases in northern regions because of the increase in the global temperatures, and so the spreading of the vector, sandfly vector.
What then is the way to prevent the spread of disease in both humans and animals?
So there is a vaccine for canal leishmaniasis, but it does not prevent against the infection. It just reduces this vaccine, the clinical presentation of the infection. So basically, it is not a good tool for preventing the infection by leishmania. And the only way for preventing the infection is treating animals using repellents and pyrethroids that have an anti-feeding effect on sandflies.
How we can control the stray dogs, and what is your recommendation for stray dogs in the context of suppressing the spread of disease in human? Testing is option, euthanasia is option.
Mm-hmm. For animals, for stray animals, the only option for these animals for preventing the infection by canal leishmaniasis is the use of pyrethroids and or repellents. And in this way, we may reduce the infection rate of sandflies of the vector to so reduce the infection also to humans. The problem is that if we think that a good option could be euthanize, the euthanasia of dogs infected by canal leishmaniasis is not effective at all. It's not sustainable, and it's not just a problem of ethical issue, of ethics, but is mainly a problem, a scientific evidence that where animals infected by canal leishmaniasis have been killed, euthanized, in order to prevent the infection in human populations in the same environment, this measure was not effective at all. So, for example, in Brazil, where they used to kill, euthanize animals, dogs, which were positive for canal leishmaniasis, the number of human cases in the same areas did not decrease at all over the years of observation. Translated in public health policies, euthanasia, killing dogs, is not effective at all. There are several reasons for that. The first reason is that if we decide to kill animals that are positive for leishmania, other animals, younger animals, will be in the same condition in few months, and so they will be even more exposed to infection or new infection of leishmania. Importantly, if we decide to kill animals that are positive, there are other animals that may be infected by leishmania, and so they may maintain constant the prevalence of the infection in the same area. I give you an example, that is, if we decide, for example, in Apulia region where I live, that is very endemic, highly endemic for canine leishmaniasis, if we decide to kill all animals, for sure other animals will be infected more than dogs, and then they will maintain the biological life cycle. Other animals are rats, for example, also are cats, foxes, wild animals. So this is not a good strategy because, it's impossible to get rid and to kill all animals because of for protecting humans.
Do you recommend the testing of stray dogs?
Stray dogs should be tested, for sure, should be tested. But, the problem is that when you test stray dogs and you do not protect them with repellents, they may be negative, then you do not euthanize them, but the day after they may become positive. So the prevention is the best strategy for reducing the risk of infection to humans. And importantly, we are talking about very few, a small number of human positives for canine leishmaniasis by Leishmania infantum. We are talking about in all Europe, if you include also Turkey, that is one of the most endemic countries in Europe, in the Mediterranean basin, we are talking about 2,000 cases of human leishmaniasis. And the patients that are infected by Leishmania infantum who present also clinical signs are mainly those immune depressed. Otherwise, we may be exposed to the infection. I am positive for Leishmania, but I'm healthy. So it's not really a problem for human health.
Is the suppression of sandflies a more effective way to control the spread of disease?
Sure. Suppression of sandflies and reducing the risk of bites of sandflies is much more effective. But the problem is that you cannot do it in the environment, but you should do on hosts by using repellents that are useful to reduce the bites. Because why you cannot do in the environment? Have the biological life cycle in very hidden environments between the stones, in the ground. So it's almost impossible to treat with pyrethroids or with other insecticides all the sites where they live. The most important thing is that we must choose carefully the strategy, the most effective strategy for doing this. And the most effective strategy for doing this is demonstrated by science, is not killing or euthanizing animals in any way.
Professor,
Simply because we have evidence that where this strategy has been applied, the number of human cases didn't decrease at all.